detect skin cancer. He has been a software developer for more than 14 years and has been involved in many startups and projects that push the envelope of innovation. He is part of the Intel Software Innovator Program and focuses on emerging technologies like AI and IoT. So at this time, we'll invite Peter Moff. Thanks so much.
All right. So, hi, I'm Peter. Originally, I thought this was like a 5-minute investor pitch, so I changed my slide a little bit just to give you more story. Since I'm not getting money here, so we can explain how we actually built the entire AI company. So, this is Dr. Hazel, real-time skin cancer detection. So for most of my career, I'm kind of known for winning hackathons. Some of the audience here probably know me from there. Some of the stuff I've done is, my very first hackathon was sponsored by TED, so I gave a TED talk after that. I won so much of the Intel's hackathon, they decided to invite me for a software innovator project and then, program and fund a lot of my projects. Some of them was demo to John Kerry, awarded from Prince of Dubai, and on National Geographic. I've been through 5 different startups, all through different stages. Some of them end very early, others got sold to Apple. And mainly these days I focus on AI and blockchain. So between 40 to 50% of Americans get some form of skin cancer by age 65. So, and if you, with early detection, the survival rate is over 98%. This was actually the exact pitch I did back when I first built Dr. Hazel. And we spent around $8.1 billion. These are the statistics, but so there is a market for this, and there's definitely a solution. Back in September last year was when I first got involved with artificial intelligence. Most of the time, what I was most interested in was this device called the Movidius neurocomputing stick. It was an edge device that can run inferencing in real time, or close to real time, around 4 frames a second. And while I just had that, me and my partner built this Dr. Hazel, the AI skin cancer detection at the hackathon. We didn't win anything, but we got hundreds of emails afterwards, which is kind of really surprising. I've won more than 100 hackathons before. I can tell you that I have never received more than 5 emails after a hackathon. Usually it's from sponsors, just telling me, hey, you win, congratulations, if you want us to blog about this. But this is actually from real customers. We were really surprised, so we continued, we told Intel about it, and 2 weeks later, we had a front center stage at the Strata conference, giving live demo about our product that we just built, using endoscope camera, but just a basic computer, a NUC, and a Movidius neurocomputing stick. That was it. And people were quite impressed, and most of them want to sign up. They want the beta program, and they want to be involved. And what was interesting, what we were telling them, this is not very accurate. We barely got started with this, we actually met the real melanoma survivors. That was very touching for me, and we decided to continue with the project. So that's how we even got through this. And over the month, we got covered by Wall Street Journal and a bunch of other. We can discuss about that later. But so at NIPS, we were given another booth at NIPS and Intel's Dev Jam. Me and my co-founder was able to give additional cancer screening for demoing to the AI crowd. And the ball just keeps rolling. And we try to quit the project, but the project can't join us back. And during just about 2 months ago, Intel released another article about on the AI Academy on how how to use AI to help detect skin cancer. So far, we have gotten covered from Wall Street Journal, Mobile Health News. Intel IQ did a huge article on this. So I know we have about over a couple thousand emails of people literally asking us to if you read some of the emails, we could cry. It's like, I just got detected with, my father just died of melanoma. I would love a device that can help me to do the same, and stuff like that. I just kind of really want us to continue working on this project. Our vision has always been stayed the same. When we first built it, we just wanted to give like everyone free AI-powered cancer screening. And that was actually the original goal. And through technology, through the current AI classification, we can actually achieve that. And that's what the interesting part is. Next slide. This is kind of the simple stuff. You know, you've probably been hearing all day how the convolutional neural network is. We didn't really build it. We just basically leveraging the technology other people built to have a real-world application. And to do that, we have to basically, you know, repetitively train our model to actually deploy. So this is basically one of the, you know, this is basically my co-founder Mike, you know, detecting this cancer. Over here you can kind of see this is when the endoscope camera sees it on melanoma, you can basically see it versus a regular mole. That's actually my own mole. Throughout a couple months, we have different sources of data. Initially, we were just using public data that we can find online. We train it up to around, 60 to 70%. And then once we start pushing more data in from different private data sources, we got that up to 85%. And just a matter of time, we can get it to 97%. Over the month, we also realized the Stanford, there's a kid basically did this using 130,000 images, and he basically can match 26 dermatologists. And he ran into the same trouble we're going to talk about later. So just about last month, this is when I knew about Mendix. In the O'Reilly AI conference, one of the, they have a small circle of talks about during lunchtime, and one of the guys was basically using AI to detect heart pump, using the microscopic camera that's in your heart to make sure that your heart is beating right. And they couldn't pass it through the FDA. So they basically, we've been trying to find solutions for this entire time. And then he basically told me, like, I have a $60 million company making artificial heart pumps. And our solution actually saved lives. We can actually prove it. But the FDA just say they want two things. They want transparency and they want definite. And that's something that current artificial intelligence model simply does not tell. It's a black box. It simply tells you, and then they give you accuracy rate. And 99% accuracy is not definite. Those are the things that between the FDA level and then we have $60 million, then we had to abandon that project. I don't know how you're gonna get this done. So we kept in touch, and I got his number, and then eventually my co-founder and I got on the phone. He just kind of did free consulting for us. But there is one way you can get it through, probably. If you simply just give your recommendations to the dermatologist and letting dermatologist build a UI for dermatologists and then embed this into an EMR system from the physician, then you can probably do exactly the same thing. Except you're not, except that dermatologist is a final validator rather than the artificial intelligence is the final validator. And we're like, okay, this is pretty cool, except now we've got to build the entire web platform for that. And then the Nimbix is basically become the solution. Now we basically drag all the image in, and it trains much faster than before because I no longer have to build script for LMDB. I drop the stuff in, and I get my results, and I train them at a much faster rate. At the same time, they provide a web API, which I can just call right away, to kind of solve the entire infrastructure as well as the training problem. Also, they use GPUs. So this is one of the pinnacle of the solution that possibly can pass us through the get us around the FDA and keep the actual startup alive. Obviously, insurance companies really care about this. They want this to be as cheap as possible. They want this to be, early detection as cheap as possible. For dermatologists, right now, they just have to say, oh, this is not really a cancerous mole, so you don't really have to see me, because otherwise it wastes their time. And when somebody does have a cancerous mole, they come to see them, they're actually making much more money, because now they're doing surgeries rather than just like you're wasting 20 minutes of their time. That's actually a lot of their business. We've been giving a lot of demos since our TechCrunch to Strata, and AI Academy, as you can see. These are just kind of expos that Intel has been provided us. We are able to do. One of these are investor slides we were talking about earlier. Target customers first we want to do towards like an ecosystem that's closed in, so we can tap into an EMR system that we can have the entire primary physician as well as a dermatologist. This way they can communicate a lot more easier through the images as well as the recommendations coming from the melanoma classification. And go to market, HMO is first, and then secondary, you want to be able to, go towards Walgreens as well as the drugstores. Again, dermatologists will simply, just swipe left or right like Tinder to see whether you should see them or not. Sort of cancerous dating. And direct to consumer is like for the third step. When somebody had or someone's family does have a skin cancer, they can basically have it in their house. When they check it, again, send it directly to the EMR system. Ever since we started, now we have 6 people. This is kind of surprising because people kept on join, and we actually have to figure out how to divide up work among them. It was just between me and originally it was just between me and Mike. His resume is a lot more impressive than mine. And we also have a dermatologist on board now, as well as a regular a general care physician. This way, I can understand they can help us to build a product in a way where we understand the needs of both. Our roadmap is basically trying to raise a fund and then starting the FDA process. Basically, using the new process, we can get around them really easily. And because we're using GPU to train now, we got into NVIDIA's Inception program. We already spoke about FDA. So the major risk right now is basically just, once you pass FDA, we have a clear roadmap about going to an insurance company as well. And the data sources, there's many schools that's already trying to partner with us so we can train that model. And these are the reference material. You can visit us at drhazel.com. And I'll take any questions.
If I get my mic on. So this is a big deal in my family. My father has skin cancer. My mother has skin cancer. I have a boat, and so I want to enjoy my boat, but I would rather not have the same experience that my dad has had. What's the timeline? Do you think if you're successful in all of the steps before this is out in the industry?
So once this is where the interesting part comes in, right? Through Nimbix, if we can basically bypass the entire FDA approval on the medical diagnosis device, then we can probably get this done by sometime within next year. We can have a product in the market. If the FDA normally requires almost a year and a half for when the first product one comes in, right? And then that's our medical diagnosis device. If we can get around it, the dermatologist will have their office. You can simply just get an endoscope to your phone.
That's basically.
And then basically the dermatologist will be playing Tinder on it. It's like, no. When they say yes, that means you have to, they're getting your money as you're paying them,
Sure.
Actual money.
But ultimately, I would be notified that there was some concern,
Yes.
and I can respond.
Yes. You will see the results of the artificial intelligence come in. You will see the recommendation, and the dermatologist will validate it. Because right now, our original goal was replacing, and now it's not. They're replacing not dermatologists, but the diagnosis part of it, right? So you only go there when you see them, but that didn't really play well in the entire market.
So it's fair to say then, the quicker all this happens, the more lives Nimbix can save.
Yep.
Okay, that's great. That's amazing.
Yeah, I
We
have
the
quick.
microphone. Oh, we got one back there. We'll go to this gentleman next. Go ahead.
Hi, this is really exciting. Just a question on training on GPU in the cluster and then exporting it to more of an edge device for the reading. How do you find the tools today, and are you getting good inference capabilities out on the edge, or are there areas for improvement there?
So I can tell you the truth, or I can tell you what you want to hear. Like, which one do you want to?
Truth. Tell us both.
Okay. The truth is, I basically find whatever the resources you can find. Intel was providing me the entire Intel's Dev Cloud, which was really good for a while because it's a cluster of 64 CPU servers. So you can train like almost 10 to 20 models at the same time. But it is slow when you want to do something that like, oh, all I really need to do is change this parameter and I want to do something. And the GPU does perform a lot faster. But you know, I'm basically kind of using free credits from Google and Microsoft and IBM in order to do that. But through Nimbix, you kind of just drop the stuff in and just let it handle itself. So you don't really need to care because they do cluster the GPU and then it's not that expensive, or at least the deal they give to me. So that becomes a perfect usage for that.
Hi, I'm curious, where you legally got enough data to develop your technology.
Well, there's around 5,000 on the just on the Isaac website. Well, there's around 20,000. Well, there's around 25,000 now images, but there's only around like 3,000 melanomas. Because finding regular mole is not really hard. It's getting melanoma and keratoma that's a little more difficult. And then we contact a lot of schools, and right now we sign NDA, so we're not allowed to disclose who they are, but they allows us to train the model as long as they get to use the model.
So you don't necessarily have to have electronic patient health information.
No.
To do your.
No,
to run your
these are
test.
just classified image. Everything is anonymous. All that, most of these data I don't want to add. Yeah, they shouldn't be the audience. Yeah, most of them, the data are not really classified in the way that you want. Like, for example, I don't even know the age of the person or of the image. I do not even know this is the race, the age, or what the family conditions or at all. So I'm basically just pouring in raw data come in. I only know this is melanoma, and then that's just a benign, and that's a keratoma. I train based on that.
You mentioned that your goal was to get to 97%. The other 3% could be based somewhat on family history and things like that that the doctor can get.
So yeah, those are basically stuff that's the first. And second of all, you have to understand that the AI is not, or at least the deep neural learning network, the AI is not perfect. It does not give you 100%. That's because the fundamental theory, a human is not 100%. Some doctors can misread stuff, right? So this is where you have to have different types of models to actually cross compare when you look at a single target. So those are the things that a lot of us don't realize. Yeah, because it's not because in a way we trust machine, but you have to understand the neural network, when it was invented, deep learning neural network, it was based on human learning system. It's just brute force of it.
You have one or two more?
Two questions. First, what's the cost of a biopsy being done by a dermatologist? And second, do you have any ambition to reduce the number of quote-unquote needless biopsies? Is that like a long-term goal if there is to be that sophisticated and discriminant?
This is actually a short-term goal, not a long-term goal. The initial image comes in. If it just says bidden, then you don't really have to do anything. Right. So we actually try to reduce you even going to dermatologists, because dermatologists themselves try to reduce you from going there because you're clogging other people who actually have cancers most time.
I can give you some baseline information because this is in my family. I take a lot of concern about it. So I had one checked right here. It cost me $1,800 to find out nothing was wrong.
I understand that.
Yeah.
I've had it for some.
Yeah. So I know there was another one back.
It's a very interesting conversation. This is more of a business model question, and obviously there's a lot of interest. How do you think, I saw the Walgreens up there, just the types of tests you're talking about. It sounds a little bit like the Theranos business model. How do you really think you're going to be able to bypass an FDA or any sort of regulatory scrutiny like you mentioned?
So initially, our initial business model was basically selling direct devices that detects, as a diagnosis devices. And then as we find out, like the more we dig into it, we got quoted for $4.5 million to get, non-guaranteed. The consultant will work on the product, and because he has gotten FDA approval before for other projects who are similar but not using AI. But there's non-guarantee because again, FDA does not know anything about AI. because AI does not provide certainty and transparency. Those are the two things that the FDA cares the most about. And this is where we want to use dermatologists to validate as a way to bypass the FDA approval, because you are giving dermatologists a recommendation, hey, this is 60% melanoma.
You're not diagnosing.
Yeah, I'm no longer diagnosing. I'm basically passing you the information and telling you what the AI says. And then the dermatologist can make a decision. Yeah, they make the final decision, because again, end of the day, I have to find them tubes for you to go.
Yeah.
It's much easier for them to be like, hey, come to me, because I think that you should get this checked.
Let's just take one more back here.
Mine's really quick. I just had a question. I saw in the news yesterday that they have a new sticker that you put on your arm or wherever you have the skin cancer, and it detects whether or not you have cancer. Do you know anything about that? And it's just a little sticker you put on wherever you think you may have cancer.
I have not read about that yet, but my team probably have, because they've been reading the news all the time. But so there's an optical and chemical-based detection. I do this a lot, right? They both have advantages and both have disadvantages. Because the optical can be reused. Again, this is artificial intelligence, or we call it just deep learning classification. We can easily classify them, we can reuse without these one-time disposable things, which can be costly over long term. Because if you want to, they're obviously this is much. I would say that the goal for us basically is to provide a free screening for almost everyone. And we gotta make up. There's enough demand in our email box. I can show you if you really want to see. That money is really. We don't think money is really a problem here. It's just because the sheer amount of demand on this.
In reality, every time someone gets tested, whether it ends up being malignant or benign, you become more accurate.
Yep.
Over time.
That's the idea of fundamental of the deep learning and AI's business model. As more data I have, the more accurate it becomes, as the more defensive I can be.
All right. Well,
I have a question. You are using the power AI machines for the images and then to detect objects. Do you think this application can apply to detect other types of cancer?
Yeah, definitely. Because again, I've spoke to a lot of people about all sorts of cancer before. Like Stanford had a really good project that's basically detecting brain tumor, and they were having the same problems as FDA, so they switched their business model into super resolution, so that the doctor can get once they get the image, MRI instead of take 15 minutes, now take like around 1 to 2 minutes. But overall, for us to get there, there's still a long way to go because of the certainty part. So for my personal opinion, I see this technology probably being deployed somewhere maybe in China and Europe a lot more quicker than the United States, just because they don't need definitive on their answer. But Americans, as you probably realize, our value is nobody should get screwed over. Right. So if there's 1% chance this is not accurate, then we don't mess with it until we can have further proof. 10 years later, when all the other countries like, oh, you know what, this is 100% accurate now, then we join in. There is good for technical innovation, but there is also good for our human lives, value in human lives a lot more than many other nations. I'll take one more.
Quick question, have you done anything with Israel? Israel is an area that has very high incidence.
Yeah, I actually work with a company called Bayer. They use sonar to detect breast cancer.
okay. If there are more questions, I'm sure Peter's going to stick around for a little bit.
I'll be over there, so.
He'll be happy to talk to you. Thank you so much for coming today. Appreciate it. Thank you. Okay, we're nearing the end here.